there, my name is Ashley, and I work on the communications team here at Children's Wisconsin. As we begin a new year, more COVID-19 questions and concerns are coming up. Whether you have questions about quarantine and isolation, or testing and going back to school, I have two experts here with me to help answer them. Dr. Smriti Khare is a pediatrician and the president of our primary care here at Children's Wisconsin. And Dr. Michael Gutzeit is also a pediatrician and the Chief Medical Officer at Children's. Thank you for taking the time to answer questions today, Dr. Khare and Dr. Gutzeit. And thank you to those of you who posted questions prior to this discussion. If you have a question as we have this discussion today, please leave it in the comments. We'll answer as many as we can. Before we jump in, I want to note that this conversation will be based on the information available to us today, January 10th. And we're aware that as more information becomes available, these discussions may shift or adjust. All right, let's jump in. Can you both speak to what you're seeing with COVID-19 in your areas, either at the hospital or in primary care? Dr. Gutzeit, let's start with you with what you're seeing at our hospitals.
Yeah, Ashley, thank you so much. And I want to extend a thanks to everybody who's listening in today to gain as much information as possible. I couldn't emphasize more what you just said, Ashley. COVID continues to throw curveballs at us, and information that we have today may change, and we certainly want to keep people current. The other thing that I would say before I start is that the latest information from the Department of Health Services, Wisconsin Department of Health Services, shows that the latest surge in COVID, primarily driven by the Omicron virus, is quite significant. And just looking at the statistics today, we see that the case activity is what's termed a critically high level, which is the highest level possible. And that's affecting the majority of counties in the state of Wisconsin right now. We're also seeing that the trajectory, the rate of increase is up 66% over the course of the past 2 weeks. So we're certainly facing quite a bit of activity within the community. Drilling down a little bit to see how that's affecting kids. I'll comment specifically about what we're seeing in our hospitals, the Children's of Wisconsin hospitals. We're definitely seeing an increase in the number of kids who are testing positive for COVID-19. In the hospital on our Milwaukee campus in Wauwatosa in Milwaukee, we've seen that there are about 20 plus kids a day that are coming into our hospital, which surpassed the previous high that we had, which is around 15. It's important to emphasize that many of the kids are being hospitalized with COVID, not necessarily for COVID, and that's an important distinction. It means they are receiving a diagnosis of having COVID, and they may be hospitalized for other reasons, or they may actually be hospitalized with COVID as well as another respiratory infection like influenza. We are seeing those viruses occurring together in some kids. And so we're very watchful of this because we want to be very, very careful as we see what the trend continues to be, knowing that more activity, more case activity, more numbers of COVID means more kids that are going to be infected. We also know, fortunately, that most kids that come to the hospital do not have severe outcomes related to their COVID infection, but we watch that carefully because we do know that there are some who are significantly affected by that. And the one last thing I'll say before asking Dr. Khare for her comments is that, you know, as Children's Hospital, we are the health system that is dedicated to serving kids. We have more than half of the pediatric intensive care units in the state on our Milwaukee campus. And we want to make sure that we're taking every step that we can to keep everybody healthy, ourselves included, so we can provide that special, unique care to kids when they need it in our environment.
Okay, thank you, Dr. Gutzeit. Dr. Khare, what about in primary care? What are you seeing?
Sure. Thank you, Ashley. And so in primary care, we've been seeing a significant increase in the number of kids who are testing positive for COVID-19. And thankfully, as Dr. Gutzeit said, you know, the children are getting ill, but they are doing better than the adults are, meaning that we have had less serious hospitalizations or deaths related to COVID-19. So that is good. They're also getting, you know, recovering fairly easily for most part. That's what we've been seeing. So we are definitely seeing higher numbers, but it still has been, you know, it's something that we're watching very closely. So, you know, the thing that I I think about a lot is sort of this narrative that's out there that COVID-19 is not as serious an illness for children than it is for adults. And I would suggest that I think we need to think a little bit broader in terms of how it's impacting kids. So while most of the kids are doing well and recovering, there are certainly a group of kids who have needed hospitalization. And we certainly know that they've been COVID deaths across the nation. We also know that there are certain complications of COVID, such as the multisystem inflammatory syndrome and long haul COVID. Several of the children's hospitals are starting to see more and more kids with the long haul COVID symptoms. And so the disease itself does have potential to be dangerous for children. But children are impacted by this pandemic in so many other ways. Many of their caregivers have had serious illnesses. There are 100,000 plus children across the nation who have lost a caregiver to the pandemic in these last couple of years. And all of that takes a significant toll on our children's mental and behavioral health and emotional health. And so it is really an area that I think we're seeing a significant impact. As we all know, we all believe children should be in schools, but considering what has happened during the pandemic, they have not always been able to be present in schools. And so we know that reading and writing and math skills are impacted across the nation as well. So it's an area that we continue to watch. As many of you know, at Children's, we are working hard to be able to meet the needs, the mental behavioral health needs of our kids. Just to give you some perspective, the CDC has numbers out on this as well, but the number of children who turned up in emergency rooms between the age of 12 and 17 for mental health reasons in 2020 bumped up by about 31%. At Children's, we saw an increase of upwards of 40% in our emergency room mental health visits. And these usually are significant episodes of anxiety, depression, or suicidal ideation. So it's something that is very much impacting our kids. The other two sort of things that I would talk about is, again, we've talked about our national academic concerns in terms of how kids are doing, and then the increase in the rate of violence in the kids 17 and under in our community in particular has been significant. The number of homicide deaths from gunfire have significantly increased. It was 54 in 2019, and we have had upwards of 99 in 2021. So all of these certainly suggest that the pandemic is taking a toll on our children, and definitely really pushing us to sort of think about this broadly and as a public health issue. And the better we do with managing COVID-19, the better our children will do and be able to get back to some level of normalcy. So it's definitely an area we're worried about.
Sure. And you had mentioned something that's a really big topic right now. Many families have COVID-19 related questions as they are sending their kids back to school, or they're going back to school fully virtually at this moment. Let's start with that. Should kids be going to school in person or virtually? Dr. Khare, let's start with you.
Yes, and I think that, as pediatricians and really pretty much anybody who works with children and has children or knows somebody who has children, we all believe that children do better in the school setting. I mean, it really allows them to be able to connect with other kids. We know that the impact of losing that social connectedness is really difficult for children in terms of their own mental health and resilience. We also know that there is much better learning that happens in groups. And so the other part of this whole equation is the other services that schools provide families. So, children with food insecurities, families with food insecurities can often get their meals at school, and not having the school open really complicates that. Our children with special health care needs often get a lot of support from schools, and they're getting their therapies at school. So not being in a physical school is definitely an issue. So I think our local school districts have worked really hard with their public health departments, trying to follow the guidelines of the CDC and the Department of Health and Human Services to sort of find the best possible way to have children in schools. And, the numbers are different in each school district. And so the guidelines are different in each school district, but they're trying their best to be able to keep the children in school. Dr. Gutzeit and I actually meet with school administrators and on a regular basis. And many of our doctors at Children's Wisconsin are formal or informal advisors to school districts. And so we are trying very hard to be able to provide them the best possible medical knowledge that we have on that day, so that we can keep our children in school and keep them healthy. And that being said, as the numbers increase, we know we have challenges. Dr. Gutzeit, you want to add to that?
Thank you, Dr. Khare. Your answer is so complete. Just a few things I would actually augment and reemphasize. First of all, we are very thankful and grateful to the teachers, the school leaders, the administrators, everybody who's trying to manage this very, very difficult situation and navigate it, where things are changing day to day, week to week, month to month. It gets very, very hard to keep up with all the information that's flowing. And we know this is a huge challenge. The other thing that I would emphasize is we all have the goal of safely keeping kids in the classroom. And we know that there are some ways to do that. Using particular strategies that have worked effectively over the past couple of years is very, very important. So we want to make sure that we use masking, washing hands, watching our social distance, and certainly we emphasize getting the safe and effective COVID vaccine if one is eligible. We think that's very, very important. And again, one other thing I would emphasize is what Dr. Khare said: work with the local health department, with the Wisconsin Department of Health Services, and guidance from the Centers for Disease Control, the CDC. There's some excellent information that can provide updates and keep you current on the information related to that. One last thing I would say is that using masking is an important strategy, and there are some options that schools have used, like cohorting or even limiting movements from classroom to classroom. Each school will find a solution that works for them, for their space. Each has unique challenges related to space, related to classroom settings and things like that. So we certainly look to those specialists and experts within the actual schools, district, and schools themselves for that.
Okay, let's dive in a bit more to testing. What are your recommendations for testing for COVID-19, especially as it relates to schools and kids? Dr. Gutzeit, let's start with you.
This topic reminds me that COVID has brought a lot of new language and lingo into our daily talk, hasn't it? So COVID testing, things like PCR and antigen and at-home testing and source control and herd immunity and things like that. 2 years ago, nobody knew any of these words, and now they've become kind of commonly used terms. Ashley, I appreciate the question, because it is important to understand just a little bit about the testing, because you do hear things like PCR, antigen, at-home testing. There's another term called nucleic acid amplification testing too. So let's give a little bit of a quick rundown of what the lingo means. So PCR is an acronym for polymerase chain reaction. That's a test that's done in a laboratory, and these are considered the gold standard tests, the most accurate tests in terms of getting an answer about COVID. They are usually taken from a person's nose, and we use these types of tests at Children's in our laboratory to get the most accurate answer. They do require additional work, as you can imagine, because there is laboratory effort and laboratory expertise involved. The term that's come up quite a bit recently is antigen testing, because many of the home kits are antigen tests, and antigen tests are commonly used to diagnose things like respiratory syncytial virus and influenza. They've been a standard and a kind of a workhorse for many of us in our primary care settings and other settings to test for those types of viruses. They're usually referred to as rapid rapid tests. They're not quite as accurate as the PCR tests, but they are very accurate. They can provide accurate results, not as accurate as the PCR tests, especially when it comes to the positivity rate. Some of the antigen tests might not be quite as accurate, but the advantage is they can be run quickly and they don't need the use of a lab or that expertise. They do require a nasal swab, and it's inserted into your nostril. So one of the, then there's been a lot of talk about at-home testing. Well, the at-home test kits are usually antigen tests, and they can be done in the convenience and comfort of your own home. They do tell you the results quickly, and they do give you guidance in terms of what might be a next step. What we usually say is if an antigen test is positive, it's likely going to be positive on the PCR as well. And this is just a general statement. If an antigen test is negative, it may be negative, but there may be some percentage of people who would have a positive test if they tested in a PCR. So there's different strategies for using those tests. I think the bottom line is testing is a very important strategy. It's essential that we be able to have those tests available. And I know it's been a challenge getting some of those tests, both the PCR test, scheduling a PCR test, as well as getting an antigen test. So just as a quick recap, the PCR tests are better to detect COVID-19 even if the person has no symptoms. An antigen test is accurate when a person already has some symptoms, and that can help determine the positivity. Dr. Khare, I think you probably have some additional input that you might be able to add to the testing approach.
Yeah, no, that was great. I think what I did want to call attention to is when it comes to schools, the Wisconsin Department of Health Services has really implemented something that has been very helpful, the K-12 testing program for the 2021-22 school year. And many of the school districts in our community are participating in this. It really makes testing available to the school free of charge, and it helps support them in making decisions about, just really the health and well-being of everybody in that school. So the testing allows the school to be able to understand who needs to quarantine at home, who can continue to go to school, and so it gives them that extra layer of information. So while the schools are using rapid tests, as Dr. Gutzeit just explained to us, the rapid tests are less sensitive than the PCR. It just is a really helpful second tool to use within those school circumstances to understand how they can keep children in the school district. The Department of Health has really done a good job about saying that the school districts can design their testing strategy and the program as long as they're aligning with the CDC guidelines, which is very helpful because we all know that schools come in different shapes and sizes, and it needs different programs to be able to be implemented. So that's been very helpful, and definitely we hope that by using maybe this testing strategy in conjunction with the public health department, we have the ability to be able to keep kids in school longer and have decreased time out for quarantine and keep children healthier as we go forward.
Sure. So staying with schools and questions about schools, many school districts have different reporting and quarantining requirements when it comes to COVID-19. What are your recommendations for reporting exposures and quarantining after exposures or positive tests? Dr. Gutzeit, let's start with you.
Yeah, boy, actually, this is a really hot topic right now. And understandably, there's some confusion because there have been some changes and updates and modifications. And this definitely falls into that category we talked about earlier, where what we're saying today may change over time. So we can offer guidance based upon what we know today. And essentially, I'll try to make it simple in that the Centers for Disease Control, the CDC, recently did update their guidelines, especially for quarantining. And there are some caveats around that because it depends on whether someone has been fully vaccinated and whether or not there are other conditions. But basically what it's saying is if one has an exposure to a known COVID positive person, that the person who's exposed should stay home for at least 5 days after the exposure. During that time, one should be monitoring for symptoms, things like runny nose, cough, fever, fatigue, loss of taste and smell, those types of things, the symptoms that we've become very common with right now, are very knowledgeable about right now. It is important to note that, that symptoms can be somewhat mild, so it's really important to do that. And one of the things that we do at Children's is when we come to work each day, we self-monitor. We check ourselves for symptoms every single day because we want to make sure that we are not developing any symptoms that might indicate an illness. So if there are no symptoms that develop during that 5 days of quarantining, then it is recommended to get a test before resuming normal activities outside of the home. So that is the recommendation that's current. Now, again, we mentioned that it can sometimes be challenging to get a test and schedule a test. So that's something that you might want to think about earlier to try and do so. If one would test positive during that 5-day period, then that would mean an additional 5 days of quarantine following that, and following the Centers for Disease Control guideline. So again, I would point people toward the CDC website. There's a very well laid out strategy that's very clear under the COVID-19 quarantine approach. I would take this time to also say that no matter what, an individual should be wearing a well-fitted mask as well-fitted as possible for at least 10 days from the date of the last close contact with an individual who tested positive for COVID. And any time that one is in a public setting. Now, I also want to make sure that we recognize that each school district, in conjunction with local health departments, Wisconsin Department of Health Services, may have different requirements for quarantining, and that is very appropriate given the conditions they might be facing and given the situations that they might be facing, they might be involved with. So what we're providing today is some general guidance based on the CDC guidelines. And again, when Dr. Khare and I talk, we often talk about the hospital or the clinic setting, which may be a little bit different in circumstances within the public, and especially within school settings. Bottom line is be as safe as possible, and we can all work together to try and stop the spread. Dr. Khare?
Sure. And Dr. Gutzeit, before we jump into Dr. Khare, I just wanted to highlight something you said. I know that it's very popular right now for people to say that the CDC simply took down quarantining time from 10 days to 5. But you're saying that after 5, you need to get a test done. And then if your test is positive, you have to quarantine for an additional 5 days, ultimately staying with that 10-day recommendation that they had previously said. So just to clarify that, we did include the link in the comments for anybody who wants to see specifically what the CDC has to say about quarantining and to help clear up some of that confusion. There's a lot of details on that website. Okay, Dr. Khare, sorry, if you want to jump in and talk about reporting or testing.
Yeah, actually, what I wanted to talk about is Mike did such a great job talking about the reporting and the CDC. What I really wanted to say is it is so important to have open communication about, what you know about your own health and others' health around you. I mean, this is a public health emergency. That means we're all linked together in this. And so the more honest and open we are about what's going on in our own families, the better we're going to do. I also think that, while school districts might have rules that we definitely want to follow and, stay within those protocols, between our own friends and family, it's important that if you are not feeling well, you are actually staying away from other humans. I mean, to me, that is just the fundamental message right now is, if you're not well, don't be out there, engaging in social interaction because you just don't know who you may be around. And if they are connected to somebody who is immune compromised, you might be creating a problem for them. So I think open communication is really, really important. I think the best policy is making sure that if your child is COVID positive or has been exposed to somebody, that you're open about that with your friends and family so that we can keep everybody safe.
Sure. Okay. And what about masking? There seems to be a lot circulating in social media and in the news about whether cloth masks are effective. What are your recommendations for masking in schools? Dr. Gutzeit, let's start with you.
Sure, thanks. And I think there'll probably be additional questions that will come in. Dr. Khare and I can provide a little bit of guidance around that. So let me give you a perspective about what we do at Children's. So at Children's, we require masks for all providers, staff, visitors, with very few exceptions. Occasionally there are some exceptions that we make, but those are very rare. And what we need to focus on is that preventing the spread of COVID and helping us get beyond the current surge of COVID relies on a layered approach. So it's washing hands, it's watching distance, it's coming to school or working one-on-one as well, not being out in public if you're not feeling well, definitely wearing masks and getting that safe, effective vaccine if you are eligible. As far as mask wearing goes, I'm going to let Dr. Khare comment about the different types of masks because that comes up sometimes, what's the most effective. But what I would say is wearing a mask is important and that is a strategy that still is endorsed by experts, including the American Academy of Pediatrics, which recommends universal school masking. And again, that's a general recommendation from the American Academy of Pediatrics. As Dr. Khare pointed out so well, that depends on local school circumstances and school situations. I think that it's also important to make sure that we use these various tiers of protection based upon COVID activity within our area. And one of the reasons that we shared that information about the current situation of COVID in the state of Wisconsin right at the beginning is to understand that we are in a very, very high rate of transmission of COVID within our environment. And so it's really important to make sure that we are accountable not only to ourselves, but to each other to try and provide the safest environment possible and protect ourselves as well as protect others who may be at greater risk by getting COVID. So we want to do everything we can. This goes without saying that things change and we need to be nimble, we need to be thoughtful, and we need to make sure that we're aware of the circumstances within our environment, within our region, and within the state as we plan for our activities and try to do the things that are so important, like being in school, being at work. Dr. Khare, do you want to talk about masks a little bit more?
Yes, for sure. It's one of our favorite topics to talk about. So I think, it's important to sort of think about what mask is effective. And some of the tips that I always like are, it should be a comfortable mask that you are willing to keep on, and you want to make sure that it fits well. Because if you're wearing a poorly fitted N95, which is supposed to be the best of masks, it's not going to help you any. So it's really important that it fits well. I think if you're wearing a cloth mask, it has to have several layers, at least 3. And if you can actually you have one of those where you can put that filter in, that's going to make the cloth mask better. A surgical mask is better than a cloth mask, and N94 and 95 is better. The higher grade of mask is going to protect you more, but they're less comfortable to wear. So it sort of gives you that sense of the gradient of how you would use the mask. And at the end of the day, anything that you do to cover your mouth and nose at this time is going to protect you. What we know about the new Omicron variant is that it is very easily transmittable. So it is one layer of protection between you and the virus outside. And it's just a smart idea right now to reconsider masking consistently when you're around other people.
Okay, and speaking of layers of protection, let's jump into vaccinations. Are vaccinations safe for kids, and do you recommend families get their kids vaccinated? Dr. Khare, let's start with you.
Yeah, so, I feel like one of the best days that we had in the last year was the day the vaccines came out for the kids, because it just sort of is a game changer, right? It gives you one more tool to use to fight serious illness from COVID-19. And so, yes, vaccines are safe for kids. We have millions of doses given now. And so we know that the vaccines are, we are monitoring the results of those doses, and we know that the vaccines are safe. Less than 1% of the adolescents who are 12 to 17 years of age required any medical care in the week after they got the vaccine. We know that there has been a concern around myocarditis with the teenagers, and we're happy to say that most of those cases have been self-resolved, and the children have been doing well after that. Compare that to myocarditis from the actual disease from COVID-19, the vaccine impact is really minimal, and the vaccines are very protective. So for all those reasons, that is important. The COVID-19 vaccines are going through a tremendous amount of oversight for safety. We still do hear concerns about they were made quickly, and I would suggest that there are two main factors in terms of why that was possible. One, there was a tremendous amount of resource allocation to making the vaccine. So, usually vaccine science is not as well resourced. So it usually takes time to be able to get there. The second part of it is with COVID-19 being so prevalent in the world, it allowed for a lot of data to be available that actually also expedited the vaccine process. So while it's expedited the advances in science that allowed us to get to this vaccine had been going on the background for decades and just really came to fruition with this vaccine. We are also concerned about, on the other side, of what is the long-term impact or issues around the disease itself. So the vaccines have been produced. We do have a lot of information about vaccines and how we follow them. So far, we have not seen any concern that these are going to show long-term effects. But we do know that the actual disease itself does have long-term effect. And so anytime that we're recommending vaccination or any medical treatment for that matter, we're always looking at the risk and benefit. And in this circumstance, the benefit of vaccines far outweighs the risk of the vaccine per se, and is significantly impactful to decrease the risk of the actual disease. So yes, vaccines are safe, and vaccines are one of the best tools we have to be able to come out on the other side of this illness.
And Dr. Khare, you mentioned myocarditis. What other concerns have you heard from parents about the vaccine for kids, and how do you help address those concerns?
Yeah, so I probably would say, and I mentioned this a little bit, there has been some real cases with myocarditis for teenage, more common in boys than in girls. And so those cases have been studied very closely. And so, yes, anything that we do as a medical intervention has some risks. The risk of myocarditis from the vaccine is very low compared to the risk of myocarditis from the disease per se. So it is something we're watching closely and monitoring closely. So that's one of the things that we definitely hear about. The other thing that we still continue to hear about is this concern around fertility related to the vaccine. And there's certainly many studies that have come out in these last several months that would suggest that that is not something we need to worry about, that it does not impact fertility. Probably one of the most impactful studies was done where they studied women who were receiving treatment for infertility, the IVF centers, and looked to see if there was any impact of the vaccine on the fertility rates of the women, and it showed absolutely no difference. So there's a study that came out recently, and this is, I'm just going to call this out around, does it impact periods for women? And there's a study that came out recently that there might be a slight change in the period that comes immediately after the vaccination period. It's a very small study, so we'll continue to monitor this, but it actually resolves itself in the month after. And interestingly, this is not something that we have studied with other vaccines. So people are going back to see that, you know, if vaccines in general have this impact. So that's something that's being studied, but it's also very short-lived if it happens at all, and seems to resolve itself. So as pediatricians, we're monitoring the safety profile very closely, and you know, definitely seeing a tremendous benefit from the vaccines compared to the risk inherent with them.
Okay, thank you. That was a lot of good information. Dr. Gutzeit, anything that you're still seeing as a concern from parents about vaccines that you want to address?
Yeah, I think Dr. Khare, that was just wonderful. Thank you for that very comprehensive information, and also the relevant and new, relatively newer studies that have come out that are showing more information about the safety of vaccines. I would just start my response by saying that, you know, as pediatricians, we focus on safety and prevention as the best treatment. And so we certainly feel very strongly that the vaccines are safe and they're effective, and we encourage everybody who's eligible to get one. The other thing that I would say is that one other topic that has come up is pregnancy and the impact of the vaccine on pregnancy. Dr. Khare, I think you may have touched on this, but I just want to emphasize again that the Wisconsin Department of Health Services has identified pregnancy as a high-risk condition for COVID. And so strongly encouraging those who are pregnant to have a talk with their primary care provider about the importance of vaccine during pregnancy. One of the things that we do hear from parents is that, well, you know, if we get the vaccine and we still get COVID, what's the effectiveness of the vaccine and why would we do that? Well, in an area where there is such high transmission rate right now, the likelihood of getting infected is greater. We do know that the most recent data from the Wisconsin Department of Health Services shows that if one is vaccinated, one is 10 times less likely to actually get COVID and 10 times less likely to have a significant illness, including hospitalization, if one gets COVID. And that's that's a general statement related to the community. So the effectiveness of the vaccine is very apparent. The data backs it up, and we have information that suggests that. And we want to make sure that, again, that helping to spread the infection into the community by getting the vaccine and doing all the other mitigation strategies is one reason why the vaccine is important. And also just we want to make sure that hospitals have the ability to provide the treatment possible. And we've all heard about the stories of hospitals being overwhelmed, hospital systems being overwhelmed with patients, and just making sure that those resources are available. So another reason to get the vaccine.
All right, thank you. Earlier you mentioned mental health, Dr. Khare. I actually think both of you have mentioned it a couple of times throughout our conversation. But Dr. Khare, can you talk more about how the pandemic is impacting kids?
Yes, and you know, these sort of studies started fairly early in the pandemic and actually came out of the East, where the disease sort of peaked earlier, and essentially has been replicated all across the globe, that children are having increase in anxiety, depression, suicidal ideation since the pandemic has started. And certainly we're starting to study more and more about what it means to be socially connected and what that disruption has really done for kids. And so it's an area that we know that there was a crisis prior to the pandemic, and the pandemic has really exaggerated the problems that our children are having. And so it's important, I think, for caregivers, parents, to really make sure that they're listening and paying attention to the children. You know, oftentimes kids will act out when they're feeling anxious and depressed. And so it tends to be the time that we sort of pull away from our kids. But, you know, listen, be open to them, because I think if they can talk to you and if you can notice the problems early, we can get them the help that they need. And I I think it's really important for the caregivers and the parents to think about their own mental health. I mean, so I talked about the kids having higher numbers of anxiety, depression, and I would say that the same is true for all adults. It's been incredibly difficult couple of years. And so if you're not taking care of yourself, it's that whole oxygen mask in the plane thing, right? Put your oxygen mask on first so you can take care of your children. So make sure you're taking care of yourself. That's so important. For one, it provides a good model for children. And again, if you're able to have open conversations about mental and behavioral health issues, it's so much better because it sort of brings this out of the dark and, we're able to have those conversations. All school districts are worried about this and, certainly are increasing the resources that they have to help support the kids. So please make sure that you're connecting with your school district to know what you might have available. Schools are really using some federal and state funds to help support that, and a lot of local funds as well. And so they've been very thoughtful about that. So make sure that you're looking at that. And know that you're not alone in taking care of your children. Look for help where you can. Connect with your pediatrician. Connect with your school, obviously. And then if you have other community organizations that you participate in, or your religious organizations, all of them are thinking about how to support our children at this time. So definitely reach out for help. That is about the best thing you can do to help with mental behavioral health.
Thank you, Dr. Khare. And you were just talking about some different resources for people. For parents who are looking for resources for mental and behavioral health, do you have any additional recommendations?
Absolutely. Yeah. So thanks for reminding me of that. So, we, on our website, it's shinethrough.childrenswi.org. And if you put that in, or if you go to our website and search for Shine Through, it'll pop up. We have tried to put a lot of resources related to mental and behavioral health on there. There are videos broken down by age, general guidance for families, tells you how to start conversations, how to engage. It's provided by our mental health team and pediatricians. And so there's a lot of resources available there. So definitely reach out, look on our website and connect with us through that. So not always do children actually need professional help. The videos will give you enough tips to be able to start to work with your family, and certainly feel free to reach out to your pediatricians. They can usually sort out for you what might be escalating to something that needs more care. But we're hoping that the videos will be helpful as you go forward.
Okay, thank you. We're now going to jump into questions provided by the audience. Some of these were provided leading up to the event. Some of them have been provided in the comments as we were talking. Speaking of the comments, I almost forgot. I wanted to mention that link that Dr. Khare just mentioned is available in the comments. We added it there so you can click and go to that Shine Through website. Okay, now we'll jump into questions provided by the audience. We will try to answer as many questions as possible right now, but we will continue to answer questions in the comments even after this conversation. So if you have questions watching this after it was live, please feel free to add to the comments and we will address as many as we possibly can. Okay, let's start with some questions that were asked in response to this event over the last couple of days. I'm going to show some questions on screen and then we'll have Dr. Gutzeit and Dr. Khare answer them. The first one is, can you shed any insight as to what specific conditions may increase the risk for COVID-19 for children? Dr. Khare, do you want to take a shot at this one?
Yes, and I'm understanding this question as what specific conditions might actually create circumstance where hospitalization might be possible. I mean, so that a serious illness. And so I would say that, with COVID-19 across the board and similarly in adults and in children, any significant comorbidities, so any existing other illnesses, especially respiratory and cardiac, tend to be areas that we worry about. We also worry about children who have immune compromise from any reason. So children who are undergoing cancer therapy, children who have blood disorders that compromise their immunity, or taking medications that suppress their immunity. So children who have had transplants. So I know I'm mentioning a lot of diseases. I don't think that there is one that's worse than the other at this point. We certainly haven't seen that data yet. I don't know, Dr. Gutzeit, if you have, but I haven't seen anything yet. But certainly we know that children who are vulnerable to any viral illnesses will be particularly vulnerable to more serious illness with COVID-19. And then just one last thing is if they are not able to be vaccinated. So at this point in time, it's the kids less than 5 years of age or kids who are older than 5 years of age who actually have a reason why they cannot be vaccinated. That too increases their risk for severe illness.
Yeah, thanks, Dr. Khare. What I would add to that is that we don't have the data about specific types of illnesses, but we have a roadmap from previous viral infections. So things like respiratory syncytial virus, influenza. We know that children who have underlying chronic medical conditions are more likely to have more severe complications from those types of viral infections. And that's why we emphasize annual flu vaccines as well as hand hygiene and other protective measures. So I don't want to forget to mention an influenza vaccine because I think it's very important to make sure that we're getting that as we're starting to see influenza increase in the community. As we mentioned early on during the talk today, influenza is occurring along with COVID-19. The only data that I'm aware of, and it's not data that's been widely published, is that there's a concern that children who have immunocompromising illnesses may have a higher likelihood of having complications related to COVID. But I think Dr. Khare's response was very appropriate, that any underlying chronic medical condition potentially can be worsened by COVID.
Okay. All right, jumping into the next one. Are boosters necessary for healthy young teens? Are you comfortable giving the Pfizer booster to healthy young teens? Dr. Gutzeit, let's start with you.
Yes. I'm sorry.
Yeah. No, but that is true. That's exactly what I would have said.
So Dr. Khare and I, as pediatricians, we would say absolutely. We are very comfortable with giving it to healthy young teens for all the reasons that Dr. Khare laid out as she was going through the importance of vaccines. And giving the Pfizer booster to healthy young teens is very important to protect them. Dr. Khare, I'm sure you could reiterate some of the things that you were talking about to just make sure that we're clear on the reason for that.
Yeah, and it's sort of important. I think we have so many, as Dr. Gutzeit said early on, we have so many new words and so many new concepts that have been out there that this all gets really confusing. And, one of the things to remember is these vaccines are new for a new illness. And so one of the ways we establish a pathway to a vaccine schedule is understanding, what doses are required. And what we've seen from the data is that the first 2 doses, the primary series, are good. They have great response, and then it starts to dip. But when you get the booster, there's a significant immune response from your own natural immunity that gets heightened, that helps you to protect yourself against the disease in a better way, and also against the variants. And so what we know is that we give a vaccine because we want to decrease the amount of the disease in the community. But mainly, we're also wanting to make sure that we are decreasing serious illness and death from this illness. And we find that if you get the booster, you do better with that. So that's the reason of the booster, is to really kind of jumpstart your immune system again. And this is not a new concept. We have many vaccines that require 3-dose series. We've often called the kindergarten booster for the diphtheria, tetanus, and pertussis vaccine. So it's sort of part of our lives. This is not uncommon with vaccine technology for us to be able to need a booster. And I think we don't know yet whether we're going to need a yearly vaccine or not. We know that with influenza. I think that will continue to be studied, and we will look at that. But the safety profile for the boosters has been great. It's been on par for the primary series. And yes, we're very comfortable to give a booster to a child who might have waning immunity that will make them stronger and better to fight the disease.
Okay. Dr. Gutzeit, let's start with you on this one. How is COVID-19 currently impacting the underage 5 group?
Inherent in that question is the fact that those under 5 cannot receive vaccine at this point in time. And so what does that look like? What we do know is that we continue to gather data around age specificity. And in children's, we do know that there are more hospitalizations for COVID now than there have been at any point in time in the pandemic. As we break that out by ages, we do see that it's natural for kids who are younger to be hospitalized more frequently than, more commonly, I should say, than those who are a little bit older. With viral infections. We will continue to follow the data on that specifically for those who are under 5. But again, we want to make sure that we're emphasizing that because that age group is particularly susceptible by not being able to receive vaccine, we want to watch very carefully and monitor that group very carefully too.
Okay. Dr. Khare, anything to add about the age 5 and under?
No, I think that's well said.
Okay. All right. We have a couple questions. The next couple questions are kind of more about logistics, about when to get the vaccine for someone who's had COVID-19. So we'll try to answer these ones pretty quickly here. How long after contracting COVID-19 can kids get the vaccine? Dr. Khare, do we want to start with you?
Sure. Early on when the vaccine came out, there was some hesitancy about this, but over time we have learned that as long as you are outside of your isolation period and you are feeling well and are not currently symptomatic, it's safe to get the vaccine. So when you get natural COVID disease, the vaccine only helps to boost that immunity that you've developed and make it consistent so it can last for a while. So there's no reason to actually wait past that isolation period and past feeling sick from the COVID illness. You can get the vaccine anytime after that.
Okay. Dr. Gutzeit, anything to add?
No, that was a very thorough and thoughtful response.
Okay. Dr. Gutzeit, let's start with you on this next one. It's similar. Is it advised for children who have tested positive in the middle of a vaccine series to receive their second dose as scheduled? Do you need to wait longer to get that second dose because they were infected with COVID-19?
In general, it's advisable to follow the schedule that's been laid out in terms of the timing and sequencing for the vaccine. Having tested positive in the middle of a vaccine series is not a reason to delay the second if one is outside that window, as Dr. Khare very, very clearly stated, if one is outside that period of time where isolation and the symptoms have passed. So if you're beyond that time, it's time for your second dose and you're feeling well, then one should go ahead and get that. And the other thing that's really important here, Dr. Khare, thanks for bringing that up, is that these are boosting your body's natural immune responses. So the booster, the second dose, the booster, actually getting COVID, all those are ways to boost the immune response. And we know the vaccine is very effective at doing that.
Okay. And as a reminder, as we're talking through all of these questions, we've gotten quite a few questions in the comments that are very specific to a certain child or situation to speak to your own doctors, speak to your child's doctor if you have very specific questions about their conditions and COVID-19. Okay.
Ashley, can I jump in with something? Yeah. It's something that Mike said that sort of triggered for me about, the need to follow the guidelines that are recommended. And we talked a lot about testing before, and I don't think we addressed this. But there's been this sort of myth out there about, whether you should do a throat swab instead of a nasal swab for the home kits. And I think I just want to call this out. when a kit is provided for testing, there are certain processes that they go to make sure that all of the things work. And if a test is created for a nasal swab, we should use it for a nasal swab. I think, you can compromise the result if you're doing something outside of. In bigger hospital labs, they have the ability to do different tests, and the processes are different. But if your home test says it's a nasal swab, you should do a nasal swab. You don't want to compromise that. So just thought it'd be important to throw that out there.
Yeah, very good point. Okay. All right. So when do you think vaccines will be coming for kids 2 and under? Curious if either of you have a magic ball that tells you. Dr. Gutzeit, do you want to start?
Sure, my crystal ball's been broken for 2 years now, so I don't know how accurate it is. But I think Smriti and I would agree, as pediatricians, we want that vaccine as soon as possible. We do realize, though, that we need to follow the process of collecting the data, analyzing the data, and making sure that it's safe and effective for younger children, those under 5, not just under 2, but under 5. I think this is a great example of a process that works, because there was some data submitted to potentially start vaccinating kids younger than 5. But the FDA and the other committees that look at the data said this isn't good enough yet. We need to look at more data. We need to get more information about this before we can allow this. And I think it should be reassuring to all of us that there is a process in place. There are multiple points and checkpoints along the way. And any one of those checkpoints can say this is not ready yet, and we need to go back and look at additional data. So short answer is we would hope that it's as soon as possible, as soon as it's safely possible to give that, that vaccine to younger kids.
Yeah, I can't emphasize that enough. As actually the whole process around the 2 and under is really helpful for us to understand that there's a lot of oversight and a lot of study of the data. Nobody's rushing to this. And, we're certainly, we're looking forward to it, but we have not heard yet when this is happening.
Okay. Could I circle back to one thing that Dr. Khare said before about testing and following the guideline, or following the process for testing? So do a nasal swab if it's a nasal swab, not a throat swab. I think the same thing applies to vaccines. There sometimes are questions about, should I get a different dose for my 15-year-old or 14-year-old as opposed to somebody else, or 12-year-old, or whatever it might be. The vaccines are tested based upon an age range and based upon an immune response and many other factors. So following the recommendations for the dose and the dose that's recommended for that specific age group is what we should be adhering to. Dr. Khare, do you want to?
Yeah, no, that's great. I agree. One of the things that has been confusing, because I think a lot of our pediatric medicines are based on weight. What's been a little confusing for people is this is really based on age, and it's really based on science around the maturity of the immune system. And so the dose that has been studied is probably the dose that works the best and should be given, because that's how that data is meaningful for us at the other end. So yes, I thank you, Dr. Gutzeit. That was an important thing to call out.
Okay, so we just have a couple minutes left here. We have a couple more questions that were submitted in the comments that I'm going to try to get to before we end. This one's a tough one. Cases are higher than ever right now, especially in kids, but also in the community generally. And it's only a few weeks after the vaccine was made available to those younger kids. Is there any connection that they got the vaccine and now they have COVID-19? Is there any connection there?
Yeah, thanks for the question. Thanks for the question. It's understandable that this would be something that would be asked, and it's an appropriate question. I think it's something that we want to make sure that we address. If we go back to the data that was shared at the beginning of the telecast today, the thing that we want to know is that the case rate is extremely high right now. So we know that more people are going to get COVID, but having had the vaccine reduces the likelihood of more severe illness, hospitalizations, complications, things like that. So while the sheer number of cases has increased, that's because the sheer number of cases across the whole population has increased dramatically, and that's not surprising. I think there was great enthusiasm and probably a little bit erroneous that getting the vaccine when we first started would prevent anybody from getting COVID. And that just is not the case, and we know that. It's a very effective and it's a very, very good vaccine. And it does prevent against the serious complications from COVID. But when we have such a high case rate activity, we are going to see more cases of COVID. But we won't see them nearly as high in those who've been vaccinated as those who have not been vaccinated. Dr. Khare?
Yeah, I would add a couple of points. The vaccine is not a live vaccine. There is no possibility of getting the illness from the vaccine, so it doesn't contain any live viruses. I think that's important. The other thing is when we think about the way this particular surge has happened for us, we now have global knowledge about this of, the Omicron variant being identified in South Africa, kind of this very rapid surge there. So we're following the pattern of what this particular variant has done in different parts of the globe. And the timing of it just happened to be when our vaccines were approved, which is almost, I think, for a pediatrician, reassuring, because if we knew the surge was going to happen, as Dr. Gutzeit said, the vaccine being available helps to protect the younger kids and keeps them from having serious illness. And I think that just, that's the way I would look at it, because I think the disease process is separate from the vaccine. You cannot get the illness from the vaccine.
Okay. One more question before we wrap up. With the high transmissibility of Omicron, are there concerns about picking it up from touch surfaces? Like when we first began this pandemic, there were concerns about getting something from the grocery store and having to clean that off, that type of touch surface. Or is it still just airborne at this point that we're worried about? Dr. Gutzeit, let's start with you.
Omicron, like previous variants and the original strain of COVID, is primarily an airborne transmission potential. So that is the primary way that it is transmitted. There have been questions and studies done about the transmissibility from surfaces and from towels and other things. The primary way that this is transmitted is by respiratory droplets. So somebody breathing, coughing, sneezing, and being in close contact to somebody that has an active case of the virus and getting it from them. So that is the primary mode of transmission, and I think that's where the focus should be. That's why we've been emphasizing washing your hands, watching your distance, wearing your mask, getting your vaccine. All those are very effective strategies for reducing airborne transmission of COVID.
Dr. Khare, anything to add?
No, I think that covers it.
Okay. All right, then Dr. Khare, let's start with you. Before we wrap up, is there anything else you want to add about COVID-19 and kids right now?
Oh, wow. Didn't we all hope that we wouldn't be having this Facebook Live at this point in time? So it's been a while. We've been in the midst of this for a long time. I would say, every family is different in terms of how they function through this. But the most important thing is be kind to each other, be kind to people who are trying to do their best. You may not always agree with them, but, we're all just trying to do our best. The schools are, the public health departments are, we are. And so let's be kind to each other, because it looks like we're going to be living with this for a little bit longer.
Dr. Gutzeit, anything to add before we wrap up?
Not much more than what Dr. Khare stated. I just a great deal of gratitude for those who continue to seek knowledge about COVID and want to know the best way to protect their kids. We all have a common purpose, and that is to protect ourselves and protect our kids, and allow kids to be back in school in a classroom setting. That's really what our focus is. The other thing that I would just like to emphasize, and I couldn't agree more, Dr. Khare, about kindness, realizing how this is impacting people, and it's really creating situations that where the normal coping mechanisms, the normal safety nets and the normal social networks have been frayed, and they've been broken in some cases. And that causes so much stress that creates the conditions for things like mental and behavioral health challenges to come up. And I am very proud of Children's and Dr. Khare and her team for the investment they've made in supporting kids, not only the social safety net, but also mental and behavioral health support for kids who absolutely need it at this point in time. So as parents, be aware, talk to your kids, listen. If you hear something that you're concerned about, talk to your primary care provider, your pediatrician, and seek guidance and counseling.
Okay. All right, that's all we have all that we have time for today. However, we will continue the conversation and answer as many questions as possible in the comments. We've also posted some helpful links within the comments, so visit those. Thanks to Dr. Khare and Dr. Gutzeit for taking time to answer our questions today and spending a little extra time with us at the moment. We know this is all tough. We're here to support you. At Children's, we're taking steps to keep our patients and staff healthy so our teams can continue to provide the best care. We will be here to help you care for your child, and that will never change. Please do not hesitate to call your child's doctor's office, use MyChart messaging, or our online urgent care. If you have any questions about Children's Wisconsin or COVID-19 and how it impacts kids, please visit childrenswi.org/coronavirus. There you can find all kinds of resources, from details about children's locations to blog posts on topics like this one. Thanks to everybody for watching.
Thank you.